Since the founding of the Coalition, partnerships have been critical in helping to advance our mission of improving workforce and community health. This year, we will present our inaugural Community Partnership Award to one of those organizations who, through our joint partnership, has been a catalyst in the growth of resources and thought leadership in the pursuit of better understanding and improvement of community health. Our inaugural recipient of the Community Partnership Award is the Delaware Department of Health and Social Services. For the last 3 years, the Coalition has supported DHSS work in cardiovascular health and diabetes and obesity by bringing the employer perspective to the conversation. Together, we have developed resources that are helping employers in Delaware and across our membership better understand the opportunities to address chronic conditions and gaps in care. I would love to hear from Nick Vella of DHSS and Elżbieta Dukansky of the Coalition staff about how this partnership is making real changes in Delaware and beyond.
Sure, my name is Nick Vella. I serve as the Program Administrator for the Diabetes Heart Disease Prevention and Control Program with Delaware Public Health. And essentially the mission of DHSS and public health in general is to create a healthier, better Delaware for all Delawareans and their visitors. Essentially what we're striving to do is make sure that the health outcomes are better for those who are living with chronic conditions and also preventing those chronic conditions from ever starting, no matter what your background is, your zip code, where you live, what you make, what you do, creating a healthier, more well state. The reason that partnerships like with Greater Philadelphia Business Coalition on Health and any partnership that we have are really important is because for population health, the way we advance our goals is through collaboration. Community health, population health is boots on the ground work. It's grassroots work. And through our partnerships with your organization and other agencies, we're able to really get into these communities and access components that otherwise we would not be able to do so. It's leaders in your organization that we're collaborating with who allow us to create that access, get into these communities, and address areas of health and community wellness that otherwise it's hard to reach from that state perspective. We're creating extra access for those times of our lives where we're spending in the office. We're allowing individuals to feel safe and well and happy and healthy at their job, not just at home, not just at the park, not just in bed. We're helping them actually achieve healthy outcomes at the office while they're sitting at their desk, while they're on site working. We're bridging that gap between home health and work health. And the employer is who's able to facilitate that. They're the ones who can take that extra step to make sure their employees feel connected to their health systems, feel connected to healthy outcomes, and are actually able to achieve that goal of living a more well, healthy lifestyle.
I'm Elżbieta Dukansky, the Director of Population Health Initiatives at the Greater Philadelphia Business Coalition on Health. My experience in Delaware has been really astronomical. I love the fact that we communicate with so many stakeholders, but also with DHSS, as DHSS is a huge part of our grant projects, but also the collaborations that we are working on. I think the NDPP program, the DSMES, and the cardiovascular health is truly outstanding in Delaware, meaning I love the fact how much the state actually cares about their population and population health, their communities, the resources that are available, but also the employer's side. How important it is for the employers to be engaged and, just simply use our resources, the Diabetes Resource Guide or the Cardiovascular Resource Guide or the upcoming Oncology Resource Guide. So first of all, I would like to take this opportunity to thank DHSS for not only supporting us, but also believing in the work that we can do as GPBCH in Delaware. I would like to thank Wendy and Natalie because they have been extremely helpful to get me settled in my new position, as well as Shibra and Nick, who have partnered with us for a couple of years now. It's amazing to see the work that's blooming and it's starting to actually make more sense. So again, thank you, DHSS.